I think one of the best things about our MedPeds program is how we really view our specific aims and our values as the guiding light for our program. And everything we do is around our program aims and what we really have determined as our program values. So I always like to talk about the program through the lens of our aims and our values. We have 5 program aims that we really use as a guiding light. One is that I'm really interested in not just generating good physician clinicians, but really thinking about what does it mean to be the next great physician leader? Everything we think about is through the lens of professional growth. And what do you need to be the best version of yourself in 4 years and in the future? We really want to make sure that we expose all of our residents to all aspects of the quintuple aim. This helps you be a better physician. This helps you understand why health systems are doing what they're doing, how to provide better care for your patients, thinking about quality improvement, and really provides an outline of what it means to be a physician moving forward. We really are training our residents to be great physician educators. You're going to teach no matter what you do. You're going to be teaching your patients every day of your career. You're going to be teaching family members who call you and send you pictures of what's this rash or why do I need to take this medication. Anytime something changes, you're going to be teaching your staff. Many of our residents want to enter into academic careers. So how do we make sure that we are helping generate the next group of physician educators? One of the big things that we've been doing over the last few years is thinking about what are our values. When we really look at business literature, when we look at physicians burnout data, a lot of that is based on non-alignment of values of both the program, the system you're in, and your own personal values. And we've spent the last part of a year meeting with residents, having retreats, talking about, well, what should our program values be? What should our guiding light be? How do we make sure that we all align in one way or another with our values so that when things are tough, we can go back to truly what it means to be a MedPeds physician at Geisinger. The number one is authenticity. We want people to be their authentic selves when they're here. We bring in residents from a diverse background, culturally, religiously, any numbered, all over the country, international, and we want to make sure that everyone can be their authentic selves while they're at work and with their resident friends. We really have this idea of excellence. Excellence in patient care, excellence in caring for each other, excellence in everything we do. We are not happy with just doing the status quo and doing what's adequate. We want to be the best. Some of this is MedPeds. You're doing 6 years and 4 years. You already have been committed to this idea of I'm going to do more and I want to do more. So how do we make sure that we continue to strive for this idea of excellence? And lastly, we all believe in a growth mindset. We really want people to be able to grow personally, professionally, thinking about what does it mean to live in healthcare for the next 30 or 40 years as it's constantly adapting. As you saw with our aims, there's a lot of discussion about how do we be our best selves? How do we become physician leaders? How do we use a quintuple aim? How do we think about transitions? How do we better utilize data to be better physicians? And how do we become educators? You can't do that without a growth mindset, without some idea of I need to constantly be striving to do more. I need to grow. I need to listen to podcasts. I need to go to our lecture series. I need to go to different activities that we do, all with the idea of I want everyone to leave a different version of themselves in 4 years, not just from a clinical care standpoint, but ultimately personal growth that now truly you know who you are. And we really want to bring people in that think of these values, have similar values, can feel that they can grow within these values. And ultimately, this has helped us create a MedPeds culture and a MedPeds community that really is constantly striving for more and more throughout their 4 years here, and then far into their careers if they stay.